Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverdi.
And I'm Montel Williams. We've also got some promising news for our four-legged friends suffering from cancer.
Plus, a non-invasive way to sculpt our bodies.
It's time to get started, so let's start the show right now.
Let's do it.
Come on now.
Listen to this. 1 in 4 dogs will develop cancer in their lifetime, and almost 50% of dogs over the age of 10 will get it. In fact, cancer is the leading cause of death in dogs over the age of 2. I did not know this.
Crazy. Oh,
and you know it too well.
Way too well. I know this way too well. And it's often discovered in late stages when treatment is difficult. And families of these pets are urgently looking for, new and better options, not only to prolong their companion's life, but to also give them improved quality of life.
Absolutely, and that's what we want. Today, we have good news on that front. Here to tell us more is veterinarian Dr. Brooke Fowler and Tammy Wayhouse, CEO of ELIAS Animal Health.
Thank you both so much for being here today.
Thanks for having us.
Absolutely.
So let's talk about this. I mean, we're both dog lovers. Just go ahead, tell them.
Yeah, I lost my little guy about 3 months ago. Cancer riddled throughout his body.
Yeah.
And the statistics are just, I'm so sorry. And they're so sobering, Doctor.
Abysmal. So 6 million dogs will be diagnosed with cancer every year. And the tumor we're specifically studying is bone cancer or osteosarcoma. It makes up 85% of skeletal tumors in dogs. The standard of care at this point is amputation and then additional chemotherapy. And the average dog lives 9 to 12 months. 10% of dogs will go on and have a longer-term remission. It's sad. It's pathetic.
I mean, you mentioned the standard of care, but Doctor, ELIAS has been working on an option, right? Why don't you tell us a little bit about that?
Yes. We have an exciting opportunity to bring a new immunotherapy to market as an alternative to traditional chemotherapy for the treatment of bone cancer in dogs. And it has the potential to be useful against other cancers as well. It's built on 50 years of scientific research. We've done rigorous clinical trials to evaluate safety and efficacy in dogs, and we're looking forward to the advancement of this technology.
Can we talk more about these clinical trials? Because they're really important. I mean, they really paved the way to help these dogs.
Absolutely. In our first clinical trial, we had median survival time in bone cancer dogs at 415 days, which is definitely longer than a year, compared to traditional chemotherapy, which comes in at about 270 days. Importantly, 50% of the dogs in our study were alive at the end of 1 year.
Wow.
And 36% were still alive at the end of 2 years. And if some of those dogs went on to live full lives and did not die of cancer.
Doctor, this is great.
So great. I just wanted to tell you guys a little bit about what it's like to be in that trial, what this procedure is like. So essentially what happens is patients go in, we take their tumors off, relieve pain. Part of that goes to get the diagnosis, part of that goes to ELIAS, where they then will take this tumor and create vaccines. Again, no different than a COVID vaccine or a flu vaccine to stimulate the immune system. They send those vaccines back, we give them to the patients, ramp up that immune system. They then undergo a procedure called apheresis, where we then harvest all those immune cells, ship them back to these guys. They do their magic, expand those cells, kind of make that immune system angry, want to go back in the dog and fight. Send it back to us. We put it in the patient. Then those immune cells keep being stimulated with some of the things that we're giving, and they do their work. No chemotherapy, no poisons. It's just the good old immune system fighting the cancer. It's fantastic.
It is so great that ELIAS is so pet-centric and passionate about pets' health. You make sure you guarantee data-driven, scientific-based results. Any final thoughts?
Absolutely. Everyone you meet has a cancer story, whether it's a personal diagnosis, a family member, parent, sibling, child, and also your best friend, your dog.
Which can also be your child.
Yeah. So we're very excited about the work that we're doing and the ability to bring a new technology to the veterinary marketplace, while at the same time developing clinical data that will also be translatable to improve human medicine as well.
That's fantastic. Doctor, final thoughts with you?
I'm just very honored to have been able to participate in this. It's something that I truly believe has a very important future in medicine.
Thank you
so much.
Thank you both so much for being here today.
And for our viewers who'd like more information, where can they go?
So they should visit our website, eliasanimalhealth.com. If you're looking for a place that you can visit an oncologist with the opportunity to get the treatment, that information will be listed there.
Fantastic.
Again, thank you both for being here,
Thank
okay?
you.
For sure. Look, and of course, if you want more information, you can always go to our website, thebalancingAct.com.
And we'll be right back.
Absolutely.
For the 30 million adults in the United States living with chronic obstructive pulmonary disease, or COPD, day-to-day activities can be a big struggle.
Yeah, and we'll be hearing from Dr. Raj Dasgupta on how patients can manage their disease.
But first, let's meet Chuck, once an avid golfer who is able to pick up his clubs again thanks to full cycle breathing technology. That's great news. Take a look.
I grew up in South Florida, retired from the banking business, moved up to Claremont here with the idea to play golf every day. We have friends here that we barbecue, go out to dinner with, things like that. Always had asthma as long as I can remember. I was in and out of the hospital a lot as a child, and it got worse towards about 50 years old. They diagnosed me with COPD. Then I went into emphysema, and my quality of life deteriorated quite a bit.
When we talk about here in the United States, almost 150,000 people have died and suffered from COPD. It is a chronic respiratory disorder. It's about severe airflow limitations, meaning they can't get air in, and when we talk about obstructive lung disease, they really can't even get the air out. They could have fatigue, they could have weight loss, cough, mucus production, shortness of breath, and of course, especially if there's an asthma component, wheezing. So depending upon the severity of COPD, it can definitely affect things at home, things at work. It definitely affects your lifestyle. Multiple admissions to the hospital and the emergency department. And needless to say that besides the organs in the body, talking about the heart, talking about the effects on the lung, it can definitely cause depression. It can cause anxiety. It can cause people to be isolated at home. So COPD can take a toll on every aspect of a patient's life.
Well, the COPD was just a word to me until it started affecting my life and as to what I could do. I would run out of air much faster. My condition kept progressing, and I had a lot of infections and flare-ups. Then I started with the various bouts with pneumonia and that in the hospital.
As his condition continued to progress, a new reality for Chuck set in, using supplemental oxygen 24/7.
I still tried to play golf and did play golf. I cut down the number of days. I played golf for 2 years. Then I went through my final 2 big bouts with infections and pneumonia in the hospital. And I had to quit golfing. Was able to get around a little bit. I mean, we did do some card playing. That's pretty much all we did. A little chess now and then. Well, it's kind of depressing to go immediately into fairly active to not doing anything at all. I needed to do something to get better somehow.
So the key part is, after they get the diagnosis, is to have shared decision making. Make sure I understand what they want to accomplish, what are their limitations. And I feel that after they get this diagnosis, in most cases, they shouldn't have to change their lives. They could still go out and see their friends and see their families. If they want to do simple things like going to the grocery store, this can be done. And especially now that we have many new options to offer different people at different stages of the disease, this is something where people could have a positive attitude going forward carrying this diagnosis. So when we talk about COPD and treatment, one of the most important things to start these patients on is pulmonary rehab. They help you exercise. They help you understand your disease state. They help you understand the breathing techniques, because there is data that patients who are sedentary will have a higher risk of infections, have a higher risk of exacerbations. So encouraging movement is one of the core things I promote in my COPD patients. And for patients who have multiple exacerbations, I'm very happy as a clinician that there are medications to reduce these exacerbations. And unfortunately, many of my patients may need supplemental oxygen.
As COPD progresses, the muscles that support natural ventilation have to work harder.
Full cycle breathing can help patients both breathe in more oxygen and then expel CO2, giving those fatigued muscles a rest.
Thus, less shortness of breath and more energy to remain active.
There's a certain stage where patients can't keep up with their own ventilatory needs. And when this happens, they need assistance. And this can be done in two ways. It can be done invasively, where unfortunately there are individuals in the ICU that have a tube past the vocal cords. We also have non-invasive ventilation through an interface such as a mask, whether it covers the nose or the mouth and nose. And it's amazing when we talk about the non-invasive, there are devices out there that can help patients with COPD be mobile. And that's always going to be a very important part.
Even with oxygen, you're still going to have difficulty breathing. At least I did. So I talked to the doctor. I says, is there anything else I can do? Rid of this tightness in my chest all the time. And they said, well, the best thing for you then is to get you into a breathing machine. I was thinking to myself, oh boy, you know, I've got to wear a breathing machine. And well, it turned out that wasn't it at all. So the Life 2000 came around. Well, the trainer came out right away and hooked me up immediately, showed me how to use it. It's very easy to use, really it is. Glad it doesn't have a mask. The nasal cannulas they give you have a pillow interface, so they're even easier to use than this thing. Makes it very comfortable. With the Life 2000 on, I can walk a lot farther. Play some golf, of course. I'm getting to play more and more holes. So it's really great to know that you've been released from this prison, you know. You're able to actually get out and do something. And if I hook it to the portable tank, we do our walking with that. Really nice to be able to get some exercising in. You know, you get to where you're not exercising and just watching TV all the time. It's bad for you to do that. So increases the quality of my life.
So the Life 2000 is a non-invasive machine that allows a patient to be mobile. And in fact, it's not really a mask. And I think that's gonna be very important because, hey, what's the point of going out if you can't eat and talk and do the things that make you happy? You know, I've been working with Hillrom for a while, and I just feel that they really do care about their patients. One of the things that gives me comfort is that I know that Hillrom will provide some supportive staff, because it can be overwhelming when you have a device. So to know that they spend time with the patient to explain it, this gives me a little reassurance that, hey, if I recommend this device, that my patient will actually know how to understand it and get the maximum benefit from it. And when we talk about a device that's a portable ventilator like the Life 2000, they could walk longer, they could exercise more. And exercise, social interactions really helps out patients with COPD. So any device, such as the Life 2000, that may help patients go do these things, hey, that puts a smile on my face.
Oh my gosh, it was really quite a difference. It was very exciting because he could do so much more. He could last so much longer. You know, with the things that he was doing. We were in a lull for a little while there, and then we got the Life 2000, and that brought us back to what we were doing before. It's really improved our lives a lot. It has.
If you have COPD, speak to your doctor to see if the Life 2000 system is right for you.
And for more information, you can always visit thehillrom.com/Life2000, and of course, visit our website, thebalancingact.com.
Body contouring. In the past, it's been associated with a highly invasive, grueling experience. You know, as in traditional. No, I don't either, but like traditional liposuction.
Sure,
even the word sounds, you're like, oh.
I know. However, there are less invasive options for those who are looking to get rid of those stubborn fat cells instantly and permanently.
Joining us today, our founder and CEO of Elite Body Sculpture, Dr. Aaron Rollins, and Helen Paris, who has experienced firsthand what AirSculpt can do. Welcome to both of you.
Thank you for being here.
Thanks for having me.
Absolutely. Look, you know, it's when we talk about body sculpting, again, most people think liposuction, where, you know, take this big cannula and they go in there and suck away. But this is air sculpting, right? So
That's right.
Tell me what the difference is.
Our procedure is called AirSculpt.
Okay.
Or you could use it as a verb, you could use it as a noun. It doesn't matter, but it's a total quantum leap from liposuction. We actually take out people's fat cell by cell while they're awake. We can take out as much as they have up to the state limit, which is usually 5 liters, which is over a gallon.
Yikes.
Oh, wow.
With no needle, no scalpel, no stitches, and while you're wide awake.
Does it hurt?
It doesn't hurt at all. Most people say it feels like a massage.
Wow.
Well, let's talk to Helen, shall we?
Yeah, let's.
She actually experienced this. So tell us why you wanted to do it and fill us in.
So for me, it was amazing. Probably would have never thought it was going to be so easy as it was. It was gentle. It was, I mean, the whole experience overall, it was just amazing. And the results that I've had were, I mean, I would have never thought.
Now, there's a short downtime, right? And that's important. But now, exactly how does it work? Are you sucking fat cells through the skin?
I'll explain. Well, first of all, almost every single patient can go back to work or childcare the next day, so there really is no downtime per se.
Okay.
You can actually go back to your regular workout routine in 2 weeks, and you're supposed to walk at least 45 minutes a day, even the day after.
Oh, wow.
So how do we do this? Well, we have a mechanism that, first of all, numbs your skin using air pressure. That's one of the reasons it's called AirSculpt. Then we put a little cookie cutter in the size of a freckle, okay, which is 2 millimeters. It's also the size of your average pencil lead. And then a tube goes in and literally plucks your fat cells out in a rotational movement like this with a tiny tube. Each time it does this, it plucks individual fat cells out and puts them in a sterile container. So that tube is moving about 1,000 times a minute, and wherever the doctor points it, it does a perfect job. And as it's doing that, it's actually tightening your skin at the same time. It's one thing to get rid of fat, but you don't want an empty bag of skin.
Right.
So every vector that you're removing fat in, you're tightening skin in the same vector. And that's why our results are so good.
Absolutely. If you don't mind my asking, what area did you do?
I did my abdomen and I did, what I would say, waist.
The waist.
Yes.
And you really felt like, wow, look at me now?
Oh my God, I would have never thought, like never. And the best part about it was the whole experience for me was I never felt nervous. I went in there and I was so comfortable with like the doctor. I was talking, I was never asleep. And while they're doing it, I never felt pain.
Really?
My husband was actually the first one that tried the AirSculpt, and he did his chin, and he was like, this is like, I felt no pain, I felt nothing, like, and I was like, I'm there. I'm gonna
Especially if the man does it first, then you're really there.
Yeah. Her daughter got a mommy makeover before her as well, Gabby.
Yes. And her experience was just the same as mine.
But this isn't just for like mommies. You just said your husband
I'm a
got
recent grandmother, so it could be for anybody, really. And in reality, it's for anybody who has that stubborn fat where they just feel like they're working it and they're not getting rid of it. And this is the way to go because it just eliminates it and the results are incredible.
And you have a result even the same day you're skinnier. Our motto is if you can pinch it, we can take it. AirSculpt is only available at Elite Body Sculpture locations. We have 19 throughout the States and we're opening one in Canada.
Well, now, if people wanted to get more information, where would they go?
Oh, well, you could go to the website, which is airsculpt.com. There's also elitebodysculpture.com, which is the same. Or on Instagram, we're at Elite Body Sculpture.
Well, look, thank you guys so much for being here.
Thank you.
Thank you for having us.
For sure.
I'm going to look into this.
Oh, well, you don't have to.
Yeah, you're just saying that.
Look, if you want more information, you can, of course, go to our website, thebouncingAct.com. Well, thanks so much for joining us today.
Remember to head to our Facebook page, like us on Instagram, follow us on Twitter, and visit thebouncingAct.com to enter our latest sweepstake or giveaway.
That's a mouthful.
I got it.
Well, look, make sure you stay safe. Take care of that family of yours. We'll see you next time.